Hello, it's Dr. Rhonda Johnson. Today's Friday, June 11th, 2021. And today I'm going to be talking about guidance in terms of activities for unvaccinated people. Now, many places in the United States are opening back up, and we're seeing a return to almost pre-pandemic activities. So I thought I would, again, provide some guidance for unvaccinated people. And remember, if you're not vaccinated, you are still susceptible to the coronavirus. You're basically having your hand out and you're saying to the coronavirus, you are welcome here. So, because you're not protected against the virus, and there's still a lot of virus around, especially now with these new, more contagious or more transmissible variants. And if you listen to a previous video of mine, you would know that the highly contagious India variant, now called the Delta variant, represents 6% of all new coronavirus infections here in the United States, and it's now present in over 60 countries, and it's becoming the dominant variant for the coronavirus. So basically, for unvaccinated people, you're still living like we were in the beginning of the pandemic. You have to think about the risk of COVID wherever you go and wherever you interact with others, and how long your interaction is with others. So if you're going to engage in public activities, you have to continue to protect yourself by practicing the everyday prevention actions. And you know what they are. That is wearing a mask, socially distancing, and washing your hands. And you know you need to keep your hand sanitizer with you when you go out. Remember, folks who are unvaccinated, that close contact with people increases your risk, and you need to look at your own health risks before you go, and always be mindful of your health risks and prevention measures. So other things you need to think about: is COVID-19 spreading in your community? Will you have contact with someone who is sick, who may not be wearing a mask, or who may be asymptomatic? So if a lot of your friends are unvaccinated too, remember, you're just in a reservoir that is welcoming to COVID. You have to ask yourself, are you at increased risk of severe COVID-19 infection? What are your health risks? Again, what are the risks to your family if you get COVID? Are there other unvaccinated people in the household? So those are things that you have to think about. How many people you'll be interacting with. Interaction with more people raises your risk. Being in a group with people who aren't social distancing, who aren't wearing a mask, increases your risk of COVID. Engaging with people outside of your household increases your risk of COVID. And again, you know, people can transmit the virus to others before they know they're infected. Think about, can you keep a distance of 6 feet or more between you and other people? Think about whether the activity will be outdoors or indoors. Again, think about who you might bring COVID-19 back home to. Always think ventilation. Indoor spaces are less safe than outdoor spaces. And think time. The more time you spend with people who may be unvaccinated also increases your risk of getting infected, especially if you're not wearing a mask or they're not wearing a mask. So again, you want to stay home if you think you're sick with COVID. If you have any symptoms for COVID, you still need to quarantine for 14 days. following CDC recommendations. So again, know the incidence of COVID in your community. And again, many places, particularly workplaces, are going to start requiring COVID vaccination. So again, you may want to be thinking about whether or not you should change your mind about vaccine. So that's my message today. Again, I hope that you will reconsider your risk of COVID infection. The virus hasn't gone away, folks. And people who are unvaccinated, your hand is out there for the virus, welcoming them in. Remember that you can be sick and have few symptoms, or you can be sick and you can go on to have severe complications. Remember, long COVID is real. There are at least 55 conditions ranging from blood clots to mental effects such as PTSD, anxiety, acute psychosis, memory loss, brain fog, to heart disease, high blood pressure, to skin infections, to erectile dysfunction, to hair loss, to risk of loss of limbs that can occur following COVID infection. That's my message. This is Dr. Rhonda Johnson. As always, my views are my own. Stay safe. Again, this message was for unvaccinated people, and I hope you'll consider becoming a vaccinated, fully vaccinated person.